Both epilepsy and simple faints can be misdiagnosed and may be due to a cardiac problem. Let's start with epilepsy. In most situations, epilepsy is a primary brain disorder and it's dealt by a neurologist. However, when a heart goes into a very nasty rhythm, the first thing that happens is that the brain is deprived of oxygen. If a brain is deprived of oxygen, two things can happen. The patient could either lose consciousness suddenly or have a transient fit before losing consciousness. It's very important that if someone presents with an epileptic seizure for the first time, apart from undergoing neurological tests, which include an MRI scan of the brain and an EEG, that individual should also have a 12-lead ECG. An inquiry should be made about a family history of blackouts, cardiac disease, or sudden cardiac death. If we turn our attention to simple faints, about 90% of people in the United Kingdom will suffer a simple faint at some stage in their lives. So simple faints are very common. It's very important to be able to tell the difference between a simple faint and an ominous sounding blackout that may result in sudden death in the future. Simple faints are usually situational. There's usually a precipitating factor, either pain, hot weather, looking at something ghastly like the sight of blood. At this time, the individual starts feeling hot, sweaty, nauseous and unwell. The vision starts to diminish. They may get ringing in the ears. They may have a warning that something is going terribly wrong. They will have enough warning to put their hands out or lie down before actually losing consciousness. Witnesses will notice that the patient looked pale, but recovery is usually quick and most individuals are back to normal within 5 to 10 minutes and are able to carry on as usual. Those are simple faints. An ominous faint is one that occurs without warning whatsoever. Individual walking up the stairs and suddenly bang, they're on the floor. No warning, no chance to put their hands out, so usually associated with facial injuries or other forms of injury. And they recover immediately. They may also have preceding symptoms such as chest pain or palpitation before losing consciousness. So if you're ever dealing with an individual who has a blackout without warning, or a blackout that was preceded by chest pain or palpitation, or a blackout in an individual who has a family history of cardiomyopathy or some other hereditary cardiac condition that can cause sudden death, those individuals must be investigated before this blackout is put down to a simple faint.